Hello viewers, welcome to another question and answer series with one of our veterinary doctors here at AgriHub. And here with me is Dr. Oni Francis Adebayo. Welcome, sir.
Thank you so much for having me.
So our topic today is on coccidiosis in poultry farming. Doctor, what is coccidiosis?
Coccidiosis is actually a parasitic challenge in poultry. It's a parasitic infection caused by Emeria. The group of organisms that usually causes cocci is called Emeria in poultry. So it's caused by Emeria organism, and it is essentially a GIT problem. When I say GIT, the gastrointestinal tract, the intestine is the chiefly affected part in coccidiosis.
Actually, I wanted to even ask what is GIT. So thank God you
Gastrointestinal tract.
Okay.
It means the tube extending from the mouth to the anus.
Okay.
That is what GIT means.
Okay, thank you very much. So, how do we? What is the common symptoms of this cocci in poultry beds?
Yeah, the common symptoms of poultry in birds, I'll just list them for the purpose of time. I won't dwell extensively on any of them. You see depression. A number of the flock will be depressed. They will not be as active as they should.
Okay.
You will see ruffled coats. Their feathers will look rough. Normally, when you enter a pen, the feather should look smooth, but you see ruffled coat, which is their feather will look rough. You will see loss of appetite because they are not as active as they should be. They are sick. Some of the birds will stay off it. So you see loss of appetite. You will see, then in no time you begin to see mortality. They'll begin to die. Then at PM level, by the time you open up, before we even get to the PM level, the things another thing that you can equally see, because all those things that I've mentioned can actually be a sign of other infections like Gumboro, Salmonella challenge. But the only thing that would give you a confirmation diagnosis that what you are dealing with on the farm is cocci is when you begin to see brownish poo on the floor. You begin to see brownish poo on the floor. Normally, the poo, the dropping of poultry is actually ash with white cap, ash, and it is semi-solid. The state is semi-solid, it is not watery. But by the time you begin to see watery brownish poo, carton brown, when you see a normal carton, a brown carton, how it looks like, that is how the poo will look like. But if that is not timely attended to, you begin to see blood, frank blood. They will begin to stool frank blood, and they begin to die in droves. Wow. These are some of the signs.
Wow. So what are the most effective treatments for this cocci in poultry?
Concerning treatments, the only option that is available is actually medication for treatment. But when if we are talking about prevention, I begin to talk of things like vaccine. But for treatment, the only option that the farmer has is actually medication. And for medication, cocci drugs are actually categorized into two broad categories. Okay. You have coccidiocidal drugs and you have coccidiostatic. When you say coccidiocidal, it means cider. Cider has to do with death. Okay. That particular medication has the ability to kill the coccidiosis. But when you say static, it limits their growth. Okay. It arrests. The coccidiostatic drug arrests the growth and multiplication of the coccidiosis within the GIT, while coccidiocidal has the capacity to kill the coccidiosis. And when we talk of these two broad categories, I will not begin to give example of the individual. I will just do a broad mentioning. You have amprolium, you have diclazurine, you have totrazurine, you have sulfur dimidine, you have sulfur quinoxaline. A number of them, they are all they can either be coccidicidal or coccidiostatic. Okay. As the case may be.
For the treatment of
yes, for the treatment option.
Okay, so what about the vaccine option?
Yeah, for vaccination is actually one of the most effective way of managing cocci. Apart from being one of the most effective, vaccination is cheaper in managing cocci, because when you place the cost of managing cocci via medication side by side, cost of managing cocci via vaccination is cheaper. Then apart from that, vaccination will give you better results if properly applied and properly managed after vaccination. I will explain what I mean by that later.
Okay.
It will give you better results. Secondly, you have less mortality. Thirdly, you have your economic loss that should have result as a result of cocci outbreak will be limited, because during cocci outbreak there will be loss of body condition, like in broiler flock. Maybe a flock that has been weighing averagely, maybe on the average that has been weighing maybe 1.7 gram, 1.7 kg now. If there is a cocci outbreak, their average weight can come down from 1.7 to as low as 1.5 or 1.3, and that is massive loss for farmers. So there is limited economic loss, limited mortality, and better is better. But what do I mean by one of the reasons why there is a little technicality that is attached with coccidia vaccine, and that is the reason why after application most farmers do complain of vaccine failure.
Okay.
And the reason is because there are things that a farmer must do on the farm after vaccination to ensure there is successful vaccination. For the cocci vaccine to elicit the right immune response within the flock, it has to go through 2 or 3 cycles, meaning that the coccidiosis has to be given in the water via in form of in the water as vaccination. The birds will take it. It will go through the GIT, and it will go through a process of multiplication in the GIT. It is then passed out through the feces. Then the bird will still need to pick it from the feces again.
Okay.
And it will go through that growth and multiplication within the GIT again, which is the second cycle. They will pass it out. It will equally, the birds will still need to pick it from the litter and would have to go through the GIT once again. And each of this process takes a minimum of 7 days to be completed. So if the litter condition is not right, as at after vaccination, it will lead to vaccine failure.
Okay.
If there is, when I say the litter condition is not right, if the litter is too dry, because you need some level of warmth and moisture in the litter for there to be replication of the coccidiosis. Okay. So when the litter is very dry and the bird passes out the oocyst in the litter, it will arrest the growth of the oocyst and it will not lead to success. It will cause failure of vaccination. Equally, if anticoccidia, which are drugs or chemicals, if they are being added to the feed of a flock to which a vaccine, cocci vaccine had been given to, it will equally lead to vaccine failure. Then for examples of cocci vaccine in the market, right? We have two, at the moment I think we have two in the market. We have Livacox and we have Imocox. They are readily available in the Nigerian and they are very, very effective, provided the farmer does what they are meant to do. Lastly, before I forget, apart from those earlier conditions that I've mentioned, during expansion, for every flock to which you have given cocci vaccine to, during expansion, it is requested of the farmer to take part of the old litter and spread on the new litter, because I told you earlier that the oocyst has to go through a number of cycles for there to be successful vaccination. Yes. So if you don't spread the litter and you just expand, you now pick a category of bird and put on a fresh litter, you have indirectly broken the access. You have cut the access to the oocyst in the old litter. Yeah. So that you have vaccine failure on that new litter. So it is usually requested that you pick part of the old litter and spread on the new litter during expansion.
Okay. Thank you very much, Doctor. Now, can you discuss the importance of gut health in managing cocci?
Yes. Like I mentioned at the beginning of this question and answer series, coccidiosis is essentially a GIT problem. Okay. Essentially, it is a problem that affects the intestine chiefly, the small and the large intestine. And when you take a sample, when you cut a section of the intestine and you place it under the microscope, you will see that the intestine has a similitude with the towel, the regular towel we use at home. There's a difference between the towel and the Ankara fabric. Ankara fabric has a smooth surface.
Yeah.
But when you look at the towel has tiny, tiny raised folds, many, plenty. And that is what gives the towel the ability to soak in water as compared to Ankara fabric. So the intestine is also similar to the towel. So once there is a break in the integrity of the GIT, it causes more devastation during coccidia challenge. What do I mean now? Like if you have other bacteria, if you have other secondary infection like bacteria or viral infection that impacts on the integrity of the intestine, and there is now a secondary complication with coccidiosis, the mortality will be very, very great. The loss of body condition will be very, very great. Unlike a flock that has an intact GIT before a cocci outbreak, the consequence will not be as grave as that in which you have a leaky gut, a gut that has been compromised. Then what cocci does to the GIT as well, it erodes. Coccidia organism causes erosion of the GIT lining. It will chop off all those little raised folds, which are the villi on the intestine, and you will start seeing bleeding. And the brownish dropping that you see in the poo is as a result of loss of blood from the intestine, as a result of action of coccidiosis on the intestine. That loss of blood will now be acted upon by digestive juice in the intestine, by digestive juice, and it will be digested to form a brownish material, which is what is seen in the feces.
Okay. Thank you very much, doctor. Now, for biosecurity, what measures can a farmer implement to prevent cocci outbreaks?
Yes, biosecurity is very, very key for keeping every infection in check on the farm, be it viral, be it bacteria, and be it coccidia challenge on the farm. Biosecurity is very, very important. But the funny thing about coccidiosis is that coccidiosis is not susceptible to 80 or 70 or 80% of the commercially available disinfectants.
Okay.
Because the essence of cleaning and disinfection that we do at the end of each cycle is to reduce the level of environmental contamination drastically before we stock new set of birds. And you discover that during that case, we start by removing the other materials that are used in raising the birds, like feeders and drinkers. Then from there, we evacuate the litter. Then from litter evacuation, you go ahead to do cleaning with water and detergent before you now begin to apply disinfectant to surfaces. But most times, these disinfectants, be it phenol, be it whatever, they are mostly not active against coccidiosis. Even after applying this disinfectant, you go into the pen, you take sample and you take to the lab, you discover that the environment is still very, very littered and highly contaminated with coccidiosis. But there is a way you can go, there are things that you can do as farmer to pull down the level of coccidia contamination on the farm. And for as many that are interested in knowing what to do to pull down the level of coccidia contamination on their farm, they will ask a question in the comment section and we attend to that.
Please try and ask a question so that the doctor here will help us with that. All right, so let's move on. How important is nutrition in preventing coccidiosis?
Yeah, nutrition is very, very important in the prevention of cocci. Like when when we talk about nutrition, we talk about quality and quantity.
Okay.
Quality, some farmers give quality, but they don't give in good quantity. Some give good quantity, they don't give quality. So quality and quantity. Now you must make sure that you provide your flock with a balanced ration at any given time. And meaning that it has the right level of vitamin A, vitamin E, vitamin D, vitamin B, and all manners of vitamin that are and other minerals that are essential for the day-to-day metabolism of the bird. Now, when the vitamin E and the vitamin A in the feed are very, very essential for maintaining gut integrity.
Okay.
Vitamin E and vitamin A are very, very essential for maintaining gut integrity. So once when you give a poorly balanced ration to the flock, that might lead to a faulty gut. That might lead to a leaky gut, and in such a case, there will be more devastation from a cocci challenge when such happens. Then other vitamins like vitamin C,
Okay.
vitamin C, even vitamin E that I mentioned earlier are immune modulators. They enhance the immune system to function best. So when an animal is getting the right dosage of this vitamin and minerals, the animal will be able to thrive better under disease condition. It's just like comparing the response of a malnourished child and a properly fed child to a bacteria challenge. The properly fed child will recover faster and better than a malnourished child.
Yes.
So that is. Then for another angle to the effect of proper nutrition for management of cocci. Coccidia challenge thrives very, very well when there is sufficient quantity of vitamin B in the diet. So it is a blunder for you to give a vitamin that is rich in vitamin B while you are treating coccidia challenge. Because what you are doing indirectly is that you are adding petrol to a burning fire. The vitamin B is actually, it enhances the growth and multiplication of coccidia oocysts. So it is advisable for you to cut vitamin B at that level. Then nutritionally, you can equally manipulate your feed to reduce the contribution of vitamin B from the diet during that stage so that the flock can respond better and recover quickly from coccidia challenge.
Wow. Thank you very much, Doctor. Now, what are the impact of cocci in egg production? Is there any impact?
Yes. Like I mentioned earlier, coccidia challenge affects the GIT, essentially the intestines.
Okay.
And we know that the GIT is the mechanism that God has put in place for the digestion of every food that we take.
Okay.
When you give raw food to your poultry, it is not usable in that form to the body. It has to be broken down mechanically and chemically in the body for it to be useful to the body. So your every protein in the diet, the energy in the diet and the fat in the diet, the carbohydrates in the diet and the fat in the diet has to be broken. Protein will be broken down to amino acids. The carbohydrate will be broken down to glucose, while the fats in the diet will be broken down to fatty acid. It is these three end product of digestion that is useful for the body. That is what the villi of the intestine will absorb from the intestine and take into the general circulation for further processing and redistribution to cells of the body. But during coccidia challenge, if you remember, I mentioned that there is erosion of the villi.
Yes.
The villi on the surface of the intestine is eroded away. So the villi, instead of looking like a towel, now begins to look like an Ankara fabric.
Okay.
And like the example I cited earlier on, a towel will absorb more water than an Ankara fabric.
Yes.
So an intestine that is looking more like an Ankara fabric will not absorb the end product of digestion sufficiently. So bulk part of the end product of digestion will be lost in the feces. Will be lost. So you have loss of nutrients, you have loss of vitamin, you have loss of mineral, you have loss of amino acid, you have loss of glucose, loss of fatty acid, and indirectly that will impact negatively on egg production. egg production will be massively affected, because you need all these things that I've mentioned. All these things are needed for the production of egg in the body. You need calcium, you need phosphorus, amino acid. In fact, egg is chiefly made up of amino acid. Do you understand? So all these things, once they are lost via feces during a coccidia challenge, it will negatively impact on egg production.
Wow. Thank you, doctor. So our last question for today, because we need to absorb all you've said, so we'll go and practice it. Okay. Is there any difference in the approach in coccidiosis management in layers and broilers? Is there a difference?
Yes, there is a little difference in their management. Like I mentioned while I was trying to explain the things that a farmer has to do after applying coccidia vaccine to ensure successful vaccination. I said the coccidiosis that is supplied via vaccine will go through a minimum of 3 or 4 cycles. And I said each of the cycle will take a minimum of 7 days. So if you say 7 multiplied by 3, that will give you 21. Yeah. 7 multiplied by 4 will give you 20. In fact, for you to have the full effect of the vaccine, it has to go through about 4 or more cycles. So on the minimum, for you to get the fullest and the fullest benefit from the coccidia vaccine, it has to go through 4. As after 28 days, that is when you begin to see the full effect of the vaccine. And for broilers don't stay too long on the farm. You keep your broilers for, let's say, 6 weeks, max 7 weeks on the farm. So going by the vaccine approach, it's very, very okay. But I think it is better to use the vaccine more in laying birds and breeders than in broilers. So as broiler farmers, I would just advise that you stick with medication in water, and also you can equally medicate your feed. There are feed grade coccidial chemicals and medication that you can actually add to your feed, and that will help your birds to respond, or that will prevent your birds from coming down with coccidia challenge. An example of this feed grade anti-coccidia or chemical is actually ionophos. Ionophos is a wide class of chemical that can be added to the feed to limit the growth and multiplication of coccidiosis within the GIT. And a very good example of ionophore is monensin. Another example is salinomycin. Another example is maduramycin. Maduramycin. Those are the 3 common examples. Of, in fact, the most common in this environment is actually monensin and salinomycin. There are other chemicals that you can add to the feed, but as well, if you are interested in knowing other chemicals that you can add to your feed, or feed grade and feed grade coccidiostat that you can add to your feed to help you manage cocci on the farm, ask in the comment section and would actually react to that by way of answering.
Thank you very much, Dr. Adebayo Oni Francis. Thanks for this time.
Thank you for having me.